Yeah, that's unusual for sure. That's a young age to have a big stroke and to die of his stroke illness.
With the news of actor Luke Perry's death, there has been a huge outpouring of grief from both the traditional media as well as from fans online. And through all the conversation, a common theme starts to emerge: shocked that it was a stroke that seemingly took the life of the 52-year-old actor. But health experts warn that a stroke can happen at any age.
You know, it's not just a disease of the elderly, and we should always be aware of vascular risk factors and the signs and symptoms of stroke. What we try to teach our patient is the fast mnemonic, so facial droop or a drift in the arm, a loss of speech, and T in the fast is for time. Those are very firm, reliable stroke symptoms.
And if you find yourself experiencing any of those symptoms, drop what you're doing and rush to the ER right away. Time is a factor and can make a big difference in your recovery. Meanwhile, keeping on top of your blood pressure remains the best way to prevent one in the future.
Patients may not feel unwell when they have high blood pressure, but over time the high blood pressure causes atherosclerotic disease and hardening of the artery, and that's one of the main risk factors for stroke.
But naturally, it's easy for us to not think of these things while we feel well. That is until signs and symptoms start to arise.
And by that time it may be too late, right?
Dr. Lai says for those around Luke Perry's age, cardiac disease or damage to arteries could be a more likely cause, and it's not too late to rein in those longer-term risk factors like blood pressure. In Vancouver, David Zura, City News.